Hello, my name is Abdirahim Ulhaj. In this video, I would like to talk to you about a web application called Compare CVD Risks and Guidelines. The main aim of this application is to assist healthcare professionals to assess and monitor their patients' cardiovascular health status. The application incorporates many CVD risk tools and recommendations from a variety of CVD prevention guidelines. The application has got many objectives. First, it calculates for each subject his risk of developing a CVD event in the next 10 years according to a multitude of CVD risk prediction tools. This will provide us with an easy comparison of risks and will show if there is any disagreement or agreement in risk assessment for that particular patient. The second objective of the application is to investigate the trend or the progression over time in CVD risk from the first until the last recorded visit of that patient, and eventually to compare this trend to the optimal trend. Another objective of the application is to provide as well clinical recommendations to the patient by using a variety of CVD prevention guidelines. These will allow us to explore agreement and disagreement between different CVD prevention guidelines applied to the same patient. Of course, there are many other objectives of this app, but we will keep that when we will do the illustration. So now, what I'm going to do is to show you how this application works. Okay? So, when you click on the following link of the application, then you will be redirected to this following web page. Okay? You will have either to register and create an account if this is your first time, or to log in as an existing user. As I have already registered, I will just need to enter my username and password to access the application. As you can see, the application has four main tabs: Patients, Risk Prediction Tools, Guidelines Recommendations, and Research Community. The first tab, which is Patient, when you click on it, it gives you the possibility as a user to display all your existing patients. For example, click on Existing Patient, search Record. So I have here all the patients with their ID, which are registered in my database. Or it allows you as well to enter or to register new patients. So let's do that for a new patient, and let's give him an ID of 200. Let's say this is a patient with ID 200. This is a female patient born in 1st of May, let's say, 1st of May. Let me just do this. May, or the 3rd, let's say 3rd of May 1967, let's say. So this is, her age is approximately 50 to 51 years old, and then create record. Okay. Once this patient is registered, we can then assess his CVD risk by clicking on the tab Risk Prediction Tools. For this tab, there are three other tabs: Graphics, Input Entered, and General Information. In the current visit, which is under Graphics, in the current visits, in this tab, it allows us to assess the patient's CVD risk at the current visit. To do that, what we need to do is to enter the ID of the patient here, and then to enter as well his risk factors at that visit. So for example, I will keep the visit date as today. Suppose that this patient has got a systolic blood pressure 141. Her blood pressure, diastolic blood pressure is, let's say, 105. The patient is treated for hypertension, a non-smoker. Her total cholesterol, let's say, is 232 milligrams per deciliter. I can choose millimole per liter if I like. Her HDL is 85, and the level of LDL, let's say, is 175. The patient is non-diabetic, okay? She's a non-diabetic. Her CRP2, she doesn't have any history from the parent on heart attack before age 60. Ethnicity, white or Asian Indian. Click on Submit. And you have the possibility here to amend or to update your record if there is anything wrong, or just proceed when everything is okay. So click on Proceed. So the output shown here is a graphical tool. This is a graphical tool displaying all risk prediction models grouped according to the type of outcome: fatal CVD, heart CHT, heart CVD, or total CVD. The usefulness of these components, as you can see, in comparison to existing ones, is that it allows us displaying for each patient all the estimated risks at the current visit, and by doing so, the user can easily compare the estimated risks and decide if there is a kind of agreement or disagreement between these risks for that particular patient. And what we should expect is that the risk should be increasing when we go from here to here, because this is fatal CVD and this is total CVD. Let me talk to you a little bit about the risk tools used here in this application. The risk tool used include SCORE for both low and high risk countries. SCORE is the risk tool officially used by the European Society of Cardiology. We have another one, which is the pooled cohort risk equation for white and African American ethnicity. The pooled cohort risk equation is the risk tool officially used by the American College of Cardiology and the American Heart Association. Other risk tools include the one recommended by the ATP3 guidelines and the Framingham D'Agostino 2008 and Reynolds, and also the UKPDS risk engine if the patient is diabetic. A reference for all these tools and some explanation is given here below. Okay? So, if we click now on general information, like here, if we click on general information, then we will be able to see three types of information. So the first tab here is about the risk factor used in each risk prediction model. So, for example, as you can see, the SCORE risk tool for low and high risk countries uses gender, age, systolic blood pressure, smoking status, and total cholesterol as input in the risk calculation or estimation. For the pooled cohort risk equation for both white and African American, we need more risk factors such as diabetes, HDL, and treatment for hypertension. For UKPDS, we need even more risk factors, and for the Reynolds as well. The second table is about derivation. So it shows us the characteristics of the population from which each risk prediction tool were derived. And finally, CVD definition. This gives us the definition of the component of CVD in each risk prediction tool. Okay? So, as mentioned earlier, another objective of the application is to show the progression over time in the CVD risk. To show this, we have to click on this tab here. So we have to go back to graphic and click on the tab All Visits and enter the patient ID here. The patient should have at least 2 visits for the graph to be meaningful. Let's do this for a patient with ID 1 that I have in my database, and I think I have 4 or 5 visits for this patient, and click on Show. So the application is displaying here the evolution over time of the CVD risk of that particular patient. He has his first visit at around 36 years old, when he was 36 years old, and his last recorded visit was when he was approximately 40 years old. So we have a kind of approximately 4 years follow-up for this patient. This graph and all the graphs here, which are broken down or stratified by according to the type of outcomes, these graphs are showing a sharp increase in his CVD risk, which might be due to different factors, among which may be under management. The opposite can be seen for another patient. For example, I have another patient, patient number 2. If I click on show, then for this patient, it is clear that his risk is declining over time, which might reflect a good management of that patient. Okay, so now let us assess our new patient, which is ID 100. You can see this is a patient in process now, is number 100. Let's assess this patient according to different CVD prevention guidelines and see what the guidelines are telling us about these patients. So to do that, we need to click on this guideline recommendation tab. And so far, we have 3 guidelines which are implemented in this application, all from Europe and the States. Of course, there is a possibility to add other guidelines like the Canadian guidelines or the WHO, etc. So this is in process. So to assess this patient, for example, according to the European, this is European, according to the European guidelines for low-risk countries, we need to fill in this information on the left tab. The information tab here for this guideline shows the list of countries considered as low-risk countries by the European guidelines. These countries include Belgium, Austria, France, Germany, Greece, and many other countries which are listed here. So we should enter this information here or record this information. For example, does patient have any documented CVD, clinical or unequivocal? You can see here what does it mean. So we will keep everything as no here, just as an illustration. Okay, and click on submit. When we click on recommendations here, the user obtained the following results as shown here. Okay, so according to this guideline, our patient ID number 100 is considered as low risk category patient, okay, by this guideline. The primary target is an LDL below 115 milligrams per deciliter, and the secondary target is a non-HDL below 145 milligrams per deciliter. Lifestyle target includes a smoking cessation and diet, physical activity. You have everything here. BMI between 20 to 25, waist circumference, blood pressure, and so on. So all these are taken literally from these guideline, from the European guideline for low-risk countries. Now, what about the treatment or the recommended intervention for this patient? Lifestyle advice is the recommended intervention by the European guideline for this particular patient. And this recommendation has a class, okay? So we have a class of recommendation and the level of evidence for these recommendations. So the class here and the level of evidence here. Okay, to know about all classes and level of evidence, you might just go to the dictionary, which is here. If you click on dictionary, it gives you all the class of recommendations and level of evidence. Okay, if we click now on the same guideline, if we click on achievement, then the user obtained the following results regarding the achievement in terms of primary and secondary target, and also according to the lifestyle target. Okay, so for example here we can see clearly that this patient didn't achieve his target, which are LDL and non-HDL, because this is the observed measure and this is the target. Okay, so they are not reached. Waist circumference and blood pressure are not reached as target, but others here for lifestyle are achieved. Okay, now as we showed earlier for this patient, okay, and we can see it here, the guideline assigned this patient to low risk category. We can ask the question, why? Why was he assigned to a low risk category? To answer this question, we should click on this tab here, which is contribution to the risks. So this particular patient was at low risk because he has no significant risk factors here, okay, and his risk estimate for CVD was 0.47, which is less than 1%. And as you know, 1% is the cutoff value used by the European guideline to classify someone as low risk category if his risk is less than 1%. Okay? Now, as we stated before in this presentation, another objective of the application is to investigate the transitions over time in the risk categories assigned by the guideline to this given patient. To show these, what we have to do in this guideline, we have just to go and click on all visits and summary. To investigate these transitions, we need a patient with at least 2 visits. So we have to enter a patient here with at least 2 visits. This is the case for our patient that we showed before, ID 1 and 2. So let's try for patient ID 1 and click on show. As you can see now here, we will see it quickly. Yeah, as we can see here, this patient started at age 36 with a low risk category at his first visit, and then started moving to a moderate risk category, and then to a high risk category at age 39, and now at age 40 he is at very high risk category. And by the way, this is just a simulated data. This is not a true patient. This is just for illustration of this component. Okay, so we've done now with this with the assessment of this patient according to the European guidelines for low risk country. We can assess, or we will assess this patient according to all other guidelines, and I will do this just quickly. So for high risk countries, which include, for example, now as you can see here, Albania, Armenia, Belarus, and Russia, and many other countries. Okay, then we have to fill in this information. I will keep it as it is. Click on submit and then dismiss. And in similar way, we can go to all component, recommendations, achievement, contribution to the risk, dictionary, and summary. Let's assess this patient according now to this American guideline. This is the American Association of Clinical Endocrinologists guideline. Okay, and as you can see, the questions asked here by the guideline are quite different. Okay, so I will keep these as it is. So they ask about different questions, including if there is any coronary artery calcification and ApoB, plus as well polycystic ovary syndrome, and so on. So you can just answer by yes or no, etc. Just click on submit here and then dismiss. Now I can do the same thing. I can click on all the component and see the output. Let's just click on recommendation just to see what happens. So as you can see here, for this patient, he was not classified as low risk by this guideline, but at moderate risk. And we can ask why. If we go to contribution to the risk, he is at moderate risk according to this guideline because he has 2 risk factors at most, and his 10-year risk is less than 10%. Okay, let's assess the patient according to the ATP3 guideline. We have different questions here, which include as well triglyceride, etc. Then I will just click on submit to make it easier and quicker, and click on dismiss. Okay. After assessing this patient according to all guidelines now, one can click on the tab all guidelines to see the degree of agreement of guidelines towards these particular patients. So if I click on guidelines visualization, what I have here, I have a summary of the risk category assigned by all these guidelines to this patient. And as we can see, 3 guidelines are in concordance and the other guideline is different. So 3 of them are saying the patient is at low risk, and this one is saying the patient is at moderate risk. Okay, so the last thing here that I want to talk about is that the application also offers to the user the possibility to calculate not only for one patient, but for hundreds or thousands of patients, their CVD risk according to all tools shown earlier. The user has only to specify a file, an Excel file, that includes all patients with their corresponding risk factors, and upload his data set to the application. Let's do that. So if we click on research community, and then here, so you can browse the data. So I will browse my data, This is my data with all risk factors. I will just click open. So the data is uploaded here, the data set with the risk factors. So I can ask the application to estimate, to predict for all patients in this data set, to estimate all the risk tools, or just to select those that you are interested to. So I can just process with the data. And then, of course, if we go now here, as you can see, this is the data set. So for this particular patient with these risk factors, these are the estimated risks according to different risk tools. Okay? I can as well download these as an Excel file and save it somewhere if I like. Okay? Thank you very much for your attention. Please, if you have any comment, drop me an email at aulaj.shiny@gmail.com. Thank you very much.